everyone, I'm Sophia, founder of The Princess Promise, and I am here with
Dr. Rob Frankel with Mainline Gastroenterology Associates.
Thank you so much for coming on our video today, Dr. Frankel.
Of course.
So today we are going to discuss what exactly is the difference between Crohn's and ulcerative colitis. So why don't I let the doctor take it away?
Okay, well thank you. Crohn's and ulcerative colitis are both inflammatory bowel diseases, and it's important to distinguish between the two because it does affect the potential treatments that we can offer people for them. Sometimes it is difficult to distinguish between the two, and we'll talk about that in a second. So what's an inflammatory bowel condition? Let's start off with that. So it's something that separates from another condition called irritable bowel syndrome, where you actually have inflammation within the GI tract. And the main difference between Crohn's and ulcerative colitis is where the inflammation can occur. So ulcerative colitis always affects only the large intestine, the colon, and it always causes inflammation starting at the very end of the colon, the rectum, and it always is contiguous, meaning it always is, there's no normal in between. There's inflammation and it's continuous and then it stops, and then there's no normal and then starts again. So there's no skip lesions, we call them.
There's no gaps in inflammation.
There's no gaps. Crohn's disease, opposite of that, can have skipping around, and it can skip around more than just the large intestine. In fact, it can affect anywhere from what we say mouth to anus.
Or some people say tongue to tush.
That's a little bit more of a glamorous way to do it. Those are not medical terms, though.
Close enough.
So we have to say mouth to anus. And it can, so I said it can skip around, but there's more common places where it occurs. So Crohn's disease usually happens in the end of the small intestine or the very beginning of the colon. And when I say beginning of the colon, I mean the beginning of the large intestine, which is the part that's actually furthest away from the anus. That's considered the end, because that's where things end up. So usually the very end of the small intestine and the beginning of the large intestine is where Crohn's happens. But like I said, it can happen anywhere. And depending on the location, can actually determine what kind of symptoms you have. Ulcerative colitis always, as I said, starts at the very end of the colon, right at the rectum, and extends upwards to various locations.
And are there different treatments that correspond with either Crohn's or ulcerative colitis, or is it pretty much the same for both?
Yeah, well, so for mild disease, which is characterized by less symptoms and less, better quality of life overall, if you have less symptoms, it does make a difference. So ulcerative colitis typically will give symptoms because of the rectal inflammation. So rectal inflammation is not quite as common in Crohn's disease. When you have inflammation of the rectum, that's that serves as your reservoir for the poop's final destination, right? So
the end game for those of us Avengers fans.
The end game. I told you I don't know DC or Marvel. Which one are they? DC? Marvel?
Marvel.
I already forgot. So the rectum, usually when your rectum fills with stool, that sends a message ultimately to your spinal cord and then to your brain and then backwards that you have to defecate. And so when you have enough stretch of it, that signals to you have to run to the bathroom and let things go. When you have inflammation of that area, that sort of simulates the feeling that you have to go, even though there may not be stool there. So when stool is there, you have to go a lot quicker. You have to run to the bathroom much quicker because you feel like it's more stretched than it actually is. But when you don't have any stool there, you can still feel like you have to go to the bathroom. So the treatments for ulcerative colitis, for milder forms of it, is really targeting the inflammation towards that end of the rectum, because that's really what drives symptoms. And if you have mild enough of a disease, there's oral medications and sometimes rectal medications that will directly go to that area and treat that inflammation. Ulcerative colitis only affects the top layer of the large intestine. Crohn's can affect the entire layer. So those medications like the oral agents that I'm referring to, which are the mesalamine agents, so Lialda, Prizo, those sorts of medications, they just don't necessarily work quite as well in Crohn's disease as they do for ulcerative colitis. So for mild Crohn's disease, you don't typically have the symptoms I was referring to with ulcerative colitis, so those medications may not be what works best for you. But for ulcerative colitis, they can be quite effective. Once you start getting up to more significant inflammation, more significant disease, that's when some of those medications some of them overlap with both of the conditions. There's medications like Remicade, Humira, Cimzia, and Simponi actually are disease-specific. Cimzia for Crohn's, Simponi for ulcerative colitis, so it makes a difference in that situation. Entyvio works for both. And then there's a couple others that are just for Crohn's or just for ulcerative colitis. So knowing that distinguishing or knowing which disease you're treating may distinguish between what medications to use. But like I said before, 10% of cases are actually what we call indeterminate colitis. There's features of both, and while you think it may not be that complicated, if I tell you, well, ulcerative colitis affects rectum and always goes up contiguously, and Crohn's skips around, well, sometimes it's a little bit tricky. And in 10% of cases, we're not actually sure which one we're treating, but fortunately, a lot of the medications overlap with both, so that makes our job a little bit easier. In terms of complications of the conditions, I mean, that's an important factor that makes a difference. Crohn's disease, because it can affect the small intestine, the small intestine is much smaller in caliber in terms of overall diameter or width. So if you have ongoing inflammation in your small intestine for long enough, and even with your colon for long enough, particularly in Crohn's disease, you can get narrowings of the intestine, which are called strictures or stenoses. And a lot of times once those develop, if you get enough back pressure behind those, you can actually develop what are called fistulas, which are abnormal connections between one part of the intestine and either another body part or another part of the intestine. You don't see that in ulcerative colitis. Ulcerative colitis, because it just affects your colon, if it is severe enough of a colitis, you can actually get a really severe inflammation, which can lead to what's called a megacolon, toxic megacolon, which can be a severe inflammation, which unfortunately leads people to need to have their whole colon removed on an urgent basis. So those are sort of, I mean, we could talk about this for a couple hours, the differences between the two and the different manifestations, but that's sort of just a little bit of an overview.
Thank you so much, Dr. Frankel. As always, make sure to consult with your personal doctor before you make any medication or lifestyle changes. Thank you again for coming on our video.
Thank you for having me.